Hello, my dear friends. Welcome to Aspire 32. And today we are back with a very important topic. And there are so many students who have asked me about this topic from so many days. And that is how you can practice in Australia as an international dentist. And the information is very confusing when you search online or when you ask your colleagues, because so many things, some people have said there are so many changes which have happened, and some people say that it may not be possible. Fortunately today, I have one of my very good senior, a very good friend, and I'm introducing you Dr. Raghavendra Shenoy. Welcome to Aspire 32, sir, for this podcast.
Thank you, Suresh.
So let me first introduce Dr. Shenoy. He is my senior who completed his BDS in KLE Institute of Dental Sciences, Belgium, India. And then he worked for 10 years as a dentist in Goa, India. And then I suddenly saw a post on Facebook seeing that he cleared this ADC exam in Australia. And since that day, I always wanted sir to come on Aspire 32 and guide all of the budding dentists, and especially the dentists who want to go to Australia. And I'm sure sir would answer all the questions which are very commonly asked by the students. So obviously, without wasting time, sir, I want to ask you a very straightforward question, which I've been hearing from so many days, that people are saying that now it is not possible to go to Australia and by getting a license. Is that true?
No, it is not true. See, only difficulty what international students or international travelers these days face is unless you are a permanent resident or a citizen, because of the COVID restrictions, Australia is not allowing anybody to come to Australia to appear for the examinations. So, because the part two, the practical aspect of the examination, it takes place in Australia. So, you need to be physically present, and now you can't get a visa for the time being because there are some travel restrictions, mainly because of COVID. Okay, and these things will change with time. It is just because of this restriction of travel, people are saying, oh, I may not be able to go to Australia or appear for the examination. Okay, but other than that, there are no other hindrances for the whole process. I feel still it is a good opportunity for any international student or a practitioner to look into Australian Dental Council exams.
Yeah. But sir, few years back, maybe before COVID, some senior, some of the colleagues did inform us that dentistry is not in a skilled group. There is some list in Australia which allows you to get some visa or maybe to get a license. Do you know something like that? Maybe you have heard during that time.
Yes. So let me put it very straight. Okay. So the thing is, in 2014, when I was appearing for my part one, immediately after part one, I was supposed to go to Australia to appear for part two in 2015 July. So in July 2015, suddenly the Australian government took out dentistry from something called as SOL, or Skilled Occupational List. So what SOL stands for, it is like if you have a profession which is an SOL, which is Skilled Occupational List, then wherever you are based, you can apply for the visa and you can get a permanent residency straight away from your home country. So, but when things changed in 2015, especially when we were in the process of getting into the practical examination, there was a lot of confusion. The same question what you asked, even we started asking whether it is worth it or whether we should try for Australian Dental Council examination. So let me put it straight. Like if you want to come to Australia, as long as you clear Australian Dental Council examination, there are multiple pathways to get into the country. Maybe you may not get a permanent residency to start with. You may have to come and work in Australia for a couple of years, and then you get the permanent residency. So if you don't have any visa which offers you direct permanent residency, you can still apply for visas, skilled regional sponsored visas or employer sponsored visas, which eventually get you a permanent residence. So there is no hindrance as far as the SOL is, oh, everything is lost, now we can't go to Australia. It's untrue. I know maybe 100 dentists, who have come to Australia after the occupation. Dentistry has been taken out from skilled occupational list, and everybody is doing fine. So that should not stop you. So if you intend to come to Australia and practice, be a dental practitioner here, one of the primary aim you should be looking into is you should be able to clear your Australian Dental Council examinations. Once you clear Australian dental examinations, you will find a way to come to the country. And once you come to the country, there are ways of achieving permanent residence. It just may takes a couple of years more, but what a big picture, it is nothing.
The path was never easy for Dr. Raghavendra also, because after working for 10 years in India, he was in the process, and as sir mentioned that there was difficulties, but even after that he has cleared all these exams, and currently he is practicing in Australia from past 3-4 years. But sir, I wanted to know that how you started or how you got this thought, because of course whenever you plan to go abroad, you always need some support or something to look for, or someone who is always there to guide you. uh, how was your process or your thought process started? Was it very easy? Were you very clear that I want to go to Australia, or you got some inspiration from someone, with that you started thinking about it?
Yeah. So to start with, I was one of the least academically oriented students in the university. I had no real interest in dentistry when I was doing it. But once I graduated, what I thought, like Goa sounded a good place to start practice. So I went to Goa. I was lucky. I got into a good practice, and so when I started practicing general practice, over time, I realized, oh, dentistry is a good career. Like it's a beautiful kind of option for your life. And then I really started taking some interest in dentistry. So 3-4 years down the line, once I kind of practiced general dentistry, I saw the limitation of general practice in India, because to be honest, like I never even appeared for a single postgraduate exams or anything, because I really didn't want to do anything with dentistry when I graduated. So when I started general practice, when I started developing really a passion for dentistry, and that too practicing in one of the most upmarket dental practices in, I would say, in India, there were still limitations, like as far as whatever you want, like the technology. If you want to, just imagine you want to buy an intraoral scanner. So you really can't equate the cost of intraoral scanner, like just you cannot buy it. It's an investment compared to the revenues what you earn. So then I thought, oh, let me look into some options. So a few of the options which I looked into was the ORE, which is the for the UK overseas registrative exam, and Australian or New Zealand exams. The reason I chose these two countries is because I was not in a frame of mind to get back into the university or a dental school and do another 3 or 2 years of DDS or whatever kind of examinations, because once you start practicing, I feel that inclination to go back and study again the same things, which you already been practicing, it didn't make sense to me. So I had limited options. I had New Zealand, I had Australia, and I had the UK ORE examinations. So eventually, there were a couple of my friends who had already cleared Australian Dental Council examinations from KLE, Dr. Premal Patel and Kushagra Ori. And so they came in for a holiday to Goa. I met them, and then they said, "Oh, it's a good pathway to go for the, some overseas qualification." So somewhere around early 2014, after 5 years of general practice, so I said, "Let me start with the process." So to be honest, I was not like very focused. Oh, I want to do this. My focus was on my general practice in India. So meanwhile, I did the paperwork, because The Australian Dental Council exam has a few steps.
It's a really inspiring journey, and as sir said, academically, sir says he was average, but what we have to remember here is that after his passion, I think the youngsters, they should listen to his story, and that is what is the highlight. Look at sir's passion which he developed when he started practicing, and that is what, sometimes you don't know when you start your, when you're in academics, maybe you are not that interested, but it is something inspiring to listen from him. But sir, you said that there are some important steps here which I would really like to discuss in detail. What is the first step if you want to apply for this Australian Dental Council exam?
I would say, like anything else, the first step is a bit of focus. Like you should know where you want to go and a bit of discipline. And following the steps, the first step is called initial assessment. What you do is everybody who wants to pursue this Australian Dental Council exams, you should get into a website called ADC, that stands for Australian Dental Council, .org.au, AU for Australia. So this is a website which clearly mentions what you need to do if you want to practice as a dentist in Australia. So it is crystal clear. If somebody says there are doubts or I'm not sure how to go about Australian Council examinations, I feel you should put a little bit of effort to read what is written in the website. I feel nobody can give you more information than what is written on the website, because you just go into the website, you click on I want to practice as a dentist in Australia. So once you click that, it shows you the pathway. The first pathway is something called as initial assessment, which you can do sitting in India, working in India, no problem. All you need to submit is your academic certification that you have graduated from a university in India, which is recognized by Indian Dental Association or whichever authorizing bodies. And once that is done, you need to submit few certificate of good standing, some reference letters, from the professors or the person whom you worked with, or anybody from the university. You need your transcripts. Okay, and if you've been practicing, then you need, okay, how many years have you been practicing? And what is your position? And what is your resume? So these are simple, basic paperwork. You collect it and you kind of get it notarized in a particular way, which is exactly mentioned in the Australian Dental Council website, how to notarize or authenticate your papers and send it to Australia. So the cost of initial assessment, if I'm not wrong, is around 31,000 Indian rupees, or around maybe 610 Australian dollars. Okay, once you send these papers, if you are very, very meticulous and if you have sent all the paperwork according to the recommendations, I feel your initial assessment will be completed within 8 weeks. Okay, so this is the first pathway, and this is the first step in the journey where you get yourself assessed. So once this is done, it shows them that you are a recognized dental practitioner, because they don't know where you're from or which university. Or there are so many countries in the world from where people like to come to Australia. So they're just making sure you are qualified enough to get into Australian Dental Council examination.
So this is the first step which you can do by staying in India.
They're very easy. You can just be working and you take a couple of hours a day. In a week's time, your document is ready. Maybe certificate of good standing, or maybe some references if you're far away. Like when I was working in Goa, I especially came to KLE University, and yeah, so I met Dr. Al-Kakale and Dr. Baliga, who kind of gave me references, which was very useful for me. And from Goa Dental Council, because I was registered in Goa Dental Council, so I took a certificate of good standing. So one thing to remember is, like, because I first was registered in Karnataka State Dental Council, and then I moved to Goa, and my second registration was Goa Dental Council. It is very important that if you don't have a certificate history from Karnataka, get it sorted out. Like whichever state you started with, because they need your registration history from your first registration till whichever state you're practicing now and wherever you're registered now. So it is very important to have all these documents, small things. And if you are a person who is practicing on your own, so maybe your income tax returns, or your CV to support that you're self-employed. These are the things, which are very simple, basic work, which I feel should not be very difficult.
And did you take any help from any agency, any consultancy, or you think you already mentioned it, but I just wanted to get it clear. Like anybody can do it on their own without taking any help from any agency.
See, I'm telling you, like from beginning, from the initial assessment till the time I landed in Australia, let it be even visa process, I did it on my own. And to be honest, I'm not one of those smartest of persons, or who can really do things extraordinarily well. Okay, it is just you need to read the content on a website or the paperwork which is mentioned, and all you need to do is send it across and you get your initial assessment done. So if there are many people who call me and ask me, oh, how to get into Australia. I said, if you are serious, first get your initial assessment done. Because once you get your initial assessment done, I say you can call me after that. Because you may have 10 people calling you, asking you for, okay, how to go about it. Okay. So everybody is kind of busy in their own life. So if you're really interested and if you think, oh, this is the thing for me, so at least get the initial assessment sorted out. It shows your
Yeah,
inclination and
take the first
your
step, which
interest.
is easy to take without any
It is
guidance.
easy to take. Okay, once this step is done, then we go into the part one.
Hmm.
So to be honest, when I appeared for my part one, I had absolutely no clue as to how to go for part one. Because if you go to the website, they say anybody you talk to, they say, oh, you need to read all standard books and this and that. So I did that, like for first time in my life, maybe after 5 years after graduating, I stockpiled all the standard books and I said, oh wow, there were so many. And I took a 2 month break from the practice. I sat down and then I went through all the standard books because after a few years of clinical practice, they seemed much more easy than when I was in university. But realistically, there was a couple of books which people said, oh, they are also important. So I'll tell you one of the very important books for Australian Dental Council book called Therapeutic Guidelines. It's a book of maybe this size. It's like a handbook. Yeah, it is a practical guide. You carry it to the practice every day. Like if you have a doubt, or if somebody is allergic to penicillin, what to give? Or there is everything is mentioned. Or if somebody has a anaphylaxis, what to do? If you forget accidentally something, you can get back into it. Or if all small things, it's a book which may take you maybe a week to completely finish it from start to end. But even then, if you read that book, I'm pretty sure every practitioner will learn something new. So it is a very concise book. So this is one book I would strongly recommend that you should invest in, Therapeutic Guidelines. So it is not like it will give you huge leverage as far as your exam is concerned, but there will be many questions which will come from this. And once I appeared for the examination, I realized most of the questions which come in the examinations are repeated. So actually, it's good to have a sound knowledge from standard books. But yeah, I feel if you keep reading standard books, you are kind of wasting a lot of time, or maybe it may take you longer. What I would recommend you personally is catch hold of a person who has cleared part one examination recently, or there are a few individuals who have recently cleared part one examination and do online coaching. Okay, so you catch hold of them because they will have the material from last maybe 5 or 10 years. So a good percentage, I would say good 70% of the questions are invariably repeated. So you just go through that question paper. And I personally feel I was lucky that I cleared the examination the first attempt, part one, because when I went into the examination, it was everything came from couple of small books, and everything else which I read were of no use. So there are few books. One is Therapeutic Guidelines, And there is something called as 1,000 MCQs. Okay, when you go through that 1,000 MCQs, you laugh about it. Dude, you look at it and you read it once and you think, oh, this is so stupid. Like 1,000 MCQs are nothing but people who appeared for the Australian Dental Council examination. They kind of recollected the questions which were in the examination, and they put it in a book. And similarly, in 1,000 MCQs, the newer version, you also have situation-based questions and answers, which are again an extension of 1,000 MCQ. Believe me, that will be a very good book. Though you may think it's not important or the questions are too simple, but a good percentage of the things repeat.
And how do you actually apply for this exam, sir? You did mention the steps to apply for the verification, but how do you book the first exam? And I'm sure you have to give this exam only in Australia.
No, it is in India. Part one, again, see the second part of the examination. Again, you don't have to go anywhere. You can still be in India and you can appear for the examination. Like I appeared in Gurgaon back in 2014, and it happens, I guess now, if I'm not wrong, more than one locations in India. So you just after part, like once you have initial assessment, you get a reference number. So that reference number is the most important number you get. With this reference number, all you need to do is log into ADC again, same website, get into candidate portal. So put your reference number, your date of birth and whatever, and then it opens up, then you can book online. The first exam costs you 1 lakh Indian rupees or 2,000 Australian dollars. So that's the cost of the part one, because it is increased, because I guess when I appeared, it was around 1,500 or $1,400, but they made it into $2,000 for last few years. But over a bigger picture, it's not much, like but when you're working in India, okay, and when you're working, see, one of the biggest drawbacks of this exam, I'll tell you, if something should stop you from not doing this exam, it should be only the financial aspect of it. I feel there is no other aspect of this examination which is not value for money.
This reason is applicable for any country exam, sir. You take
Okay.
US, you take Canada, everywhere you can actually, if you are hardworking and with that focus, you can clear that exam. But the real test happens in the financial, especially when you
Financial.
convert Indian currency and pay in the foreign currencies. That is where people find it really difficult, right?
Yeah, that's right. Yeah. Part one. So part one happens in India. Again, you don't have to go far. You can just go to an examination center, and once you go to the examination center, I guess it happens over 2 days. You clear part one, then you're good to go for part two.
And how many days does it take for a result to come for part one?
Every Australian Council exam results are 6 to 8 weeks. So realistically, within 2 months, like you have your result. And once you have your result, then you can apply for part two. So here comes the challenge when you come to part two, because still part one, you can be anywhere, you can be practicing, you can be doing your post graduation, you can still be appearing for the exam. But when it comes to part two, there are a few things which you should really understand. So I feel one of the basic and very important aspect of part two, like part two happens over 2 days. So there are two aspects of part two. One is called OSCEs, like everybody knows OSCEs. So there will be 10 stations and there will be some situation. There may be an examiner sitting as a patient on a dental chair, and he may be asking a few questions. You need to be reasonable with him and you need to give the right clinical kind of judgment. So you have one day of what you call clinical skill day, and the second day is a technical skill day. So clinical skill day is more about clinical information gathering, and which invariably relates to OSCE. Okay, and the second technical day is the time where you perform dental procedure on a typhodont, on a mannequin. So there may be things like cavity preparation. It may be class 3, it may be class 2, it may be restoration, amalgam, or composite restoration, amalgam, especially complex amalgam restorations, where you need to kind of build up a cusp, which we never do like in a clinical
Yeah.
practice, but
I think
you
in
get back.
undergraduate level, the students really find it difficult to correlate. But maybe
Yes,
just you had a clinical experience. Maybe you had at least idea how to. But that's also very important. I want to know here, sir, that since you are
yes,
saying that all these
yes.
things are asked, how did you prepare for it?
Okay, so let me put my journey. Like I was practicing, luckily I had a very strict principal dentist under whom I trained, Dr. Anil Da Silva. He is a perfectionist in his practice. So even when I graduated and took a kind of went for the interview, he said, "Okay, so what all things you know in dentistry?" So I told him, "Oh, okay, like I'm pretty much confident in everything." Okay. So I started working with him. He said, "I'll keep you under observation for 2 months. If you perform well, I will continue with your employment. Otherwise, you'll be terminated." So the very first day I entered the practice, and yeah, pretty much I've not been much of clinical because I had very low attendance in all clinical subjects. So never practiced much. But I went to the practice. He said, looked at my work. He said, "Tomorrow you're gonna get few extracted teeth." So I said, "It's all right, like if somebody's ready to teach you." And then he kind of taught me many things on extracted teeth. So for a couple of weeks, I did cavity preparation again on extracted teeth. And then he corrected me on each and everything, let it be line angles or point angles, all the things which you endo and conservative guys teaches. So everything was refined, and he was very strict, and he always wanted the perfect result. There cannot be a little bit of excess because he was perfectionist. So invariably, I would say my passion for dentistry started with him, where I started doing things right and to some extent close to whatever I can achieve or what is considered a satisfactory or a good result in any examination. So if you're really a practitioner, or if you're a student, or if you're anybody, the first thing, focus on getting a right clinical attitude. Okay, don't leave anything for tomorrow. Okay, if you are trying to even doing a simple class 1 or a class 2 filling, get it right. Everything that taught you in university has a reason for it. So you should practically apply it and try to do your best. Mistakes can happen, but it should not be like a repetition, or you're taking things casually, or there was a bit of excess, it's all right. No, if you see a bit of excess, polish it. Okay, take an interproximal strip and remove the flash or overhang. They should not be overhang. So get your concepts, clinical concepts right. And believe me, whether you know anything in dentistry so far or you know everything, there is always room for improvement. So let it be composites, finish it well. Finishing plays a very important role in composites. Just don't fill composite, finish it well. So everything you need to learn to do professionally, because what you understand is, I feel, at least, I don't know, I'm not generalizing. I feel in India we are a bit more casual, more about everything, or chalta hai, like it's all right, no. So luckily for me, my mentor, he taught me from day one a good approach to dentistry, where he was, I would say, sometimes very strict. So almost like 1 year I worked with him, and then one fine day he came and told me, "You know what? I want to tell you something." I said, "Oh, it's been a year working with him." He said, "Today you are fit to be given the degree of BDS." He said, because he was a old school, like these guys, old school from GDC Goa, and their time they were, and he was one of those perfectionists. So 1 year working with him, he eventually came and told me, "Oh, you're good enough to be given a degree of BDS." I said, "Oh, it just took me 1 more year."
Really happy, in spite of so much of criticism from him, you feel inspired, and that is what I think everybody should understand. Because I do, as a teacher, I also understand, sir. Because when I tell our students, when that this is important at this moment, sometimes they don't realize it. And after many years, when especially when these foreign exams come, they realize that this is what was actually told to us, but that time we don't feel it is important. Like what you said now, that the perfectist work, the depth and all, the colleges do teach in India, but of course that attitude chalta hai is definitely there. And sometimes even I feel how we can change it.